Hey, how's it going?
Yeah, we're gonna be there in a second.
What the hell? Where the hell you
What?
been?
Oh, it's just been around, you know. What's going on?
Yeah, Sam's gone, but guess I just bumped into Veggy Dave.
That's... I don't know what you're talking about.
Dave.
Hey, what's up? What's going on?
Hi.
Imagine.
A friend of ours is in the ICU.
Oh, okay. Let me get, yeah, let me get my stuff.
Don't head into the side rooms, okay? For the time being.
Oh, what's up?
No, just don't head in there. Stacy's dealing with something, and you would have to hazmat up to go in there, okay?
You mean like, I see you?
No, not in the ICU. No. The
Oh,
PD side
okay.
rooms.
No worries, no
Be
worries.
careful of them. Yeah.
Okay.
Just for the time being.
You here for, whatever they were talking to me about?
For the one, yeah, the one that's
Yeah.
in the ICU.
Okay.
I was here anyway. I just can't be I just can't be on duty right now.
Okay, I understand. Don't worry about it. I'm gonna take care of it.
Dr. Legs from EMS.
Yes.
Looks like you'll have an officer regarding your 311 in about 2 minutes.
Thank
So
you.
many of you guys.
I
Oi.
don't think so. Oh, she did. Okay.
Jackie's just doing the final checks.
Oi.
Wait a second. Dave, lock the bloody door!
She's from Britain.
Okay, don't.
What's up, Dave?
You're doing okay?
Yeah, I need you to do me a favor. Come over here.
Sure.
I can't tell my doctor's office when they leave the door.
All right. I'm gonna pass off this patient right now.
Mhm.
Basically, what's going on with her right now is that she has shown signs of extreme torture. She's got whip marks all over her body. Her head looked like she had a metal plate that was dented. She had a brain bleed that I was able to stop.
Okay.
Or I was able to mostly stop. It's still bleeding, so we've had to just bandage her head. We're gonna have to take her into surgery again at some point to, fix the brain bleed further. But her vitals are too unstable right now. She had a bullet wound in her back. She had whips across her body. She was dirty. Her right leg was fractured and had healed, but the bone was out of the body and it had healed. So I had to re-break it, put the bone back in.
Mhm.
That's pinned in place. Her left leg had an open fracture on it that I have now closed the wound at least, but I haven't been able to work on the actual fracture itself.
Do you have the
She's
report
as
for
stable.
this?
I'm literally in the process. It literally just
Okay.
happened. You
Okay.
got to give me time.
No worries.
But we don't have her name right now. P is about to come down, so I just need you to kind of handle PD getting names and whatnot, and then
This one?
yes,
Or this one?
the one on the left.
In here?
Yes. Yeah. I'll get a report up in a second here, but I just need you to handle the having PD identify. And then that way we can get emergency contacts and whatnot. We're pretty sure she is a Chaos Legion member. But
Okay.
until we have emergency contacts and whatnot on record, we unfortunately can't really fill them fully in or get them in here to visit.
Okay.
So we'll have to kind of rely on PD to help us try and identify, and hopefully her fingerprints are on record.
Good.
Give me a second here.
So I heard on radio, an officer's coming down.
I got the report up as a Jane Doe for the time being. So if you get the her name from PD, just put it in there, and then once we can start confirming emergency contacts, I'll still be here, by the way, so I'll be able to answer questions that are needed and whatnot. I'm not going anywhere. I just have another patient I was already dealing with previously.
Oh, I'm gonna close the report, otherwise it's gonna fuck you.
Yep.
Okay. Sure. Dr. Skip, do you see anything I need to do right now?
Hey, you. How are you feeling? Yeah.
Shit.
I don't know what happened. I'm just got very tired.
See if I can everything comfortable.
This is what's been happening to you for the last two or so days, huh?
I heard it helps to talk. So I want to tell you what I do. Sure that everything is cleaned up. Take some light soapy water, clean skin,
And they get kicked off duty.
sure everything is cleaned up.
757 to Dr. Legs.
Yes.
What's your 20 at the hospital, sir?
ICU.
Perfect. Walking the line out.
I'm gonna take over Dr. Legs.
There you go. Just make sure I unlock the door once they come through.
What was that?
I said a PD officer is coming through in a second.
Oh, come with me, deputy.
Hey, Stacy.
We can't confirm her identity yet, so while you may confirm it, we don't know.
An officer,
We
yeah.
don't have her emergency contacts on record yet.
Oh, sorry. Misha, can you just step out?
Misha back up.
Okay. Dave is going to be going with you.
Yep. What was your name, deputy?
Jonah Slow, badge number 757, sir.
Come with me, Jonah.
He's gonna help you out for right now. If you need any other questions, just come to me.
Here. So we got this patient. Basically, we don't know who they are right now. We would like your help. The head is wrapped in a bandage, as well as both hands. Their skin is dirty from dirt.
Okay. Let me make a report real quick.
Yep. Legs are covered in bandage.
Okay. Did they have any identification on them? Like a ID in their pockets, maybe, or like a rolled up receipt or something with their name on it, possibly, or.
Let me ask Dr. Skip. He was here during the intake.
Harry.
Dr. Skip, do you have any identifying? No ID.
Harry, come here.
We found a broken phone. Okay, well, I don't know what you can do with that, but
Okay.
and as you can see, fingertips they're kind of severely really hard to.
Perry's coming through right now, and she's going to tell you how we know who she is. But we still need your help to fully identify because we don't have anything other than that to identify right now. So just give her a second to finish her call.
Yeah, Dr. Perry is not here as a capacity as a doctor because she's not well, she's not here as a doctor. She's just here as a witness, basically. But she's still, the administrator of this hospital. My name is is a Veggie Dave Sam. Well, Dave Campbell.
Okay.
Uh,
Do you? What's your state ID, sir?
uh, it is 1706.
Okay, Mr. Campbell. Thank you.
Yeah. I have a staff profile, but you might find it really difficult to find my my profile.
What was I needed for?
Hey. So, Dr. Legg said that you were here, when she was brought in, and that you have information about her identity, even though, that, like, if you could help.
Yeah, no, I know
Too
it's
busy.
so on her bracelet. It has my name. Um,
From
cause
the airport.
the I didn't know who it was originally, but after confirming, because I have many patients, after confirming like the multiple things I have done with her,
That explains why I
um,
sleeping in this
I
running
determined it was most likely Natasha Russell.
Natasha. What's the last name?
Russell.
Okay. Do you happen
Wait,
to
is it
know a
Russell?
state ID for her?
No way.
Off the top of my head, I'm trying to remember. Dave, could you search up my reports?
Yeah.
You should be able to find her in one of them. Just search up
Um.
Natasha, and you should be able to find it.
Oh, Natasha with the C. Okay.
Yeah.
All right. I think I
Yeah.
found her profile.
Hello, Bobby Russell.
Can't
Okay,
find the
now
word.
she is likely a member of the Chaos Legion MCU, and I noticed on my way in there were a bunch of Chaos Legion out front. How was she brought into the hospital?
By EMS.
One of my close friends.
Okay, now did
She's
they?
been missing for a while, from what
Okay,
Chaos Legion told me.
did EMS receive a 911 call?
I don't
She used to be one of the
I don't remember.
Okay, Kip.
Oh.
Okay. Yeah, I'm looking
Which-
through our 911 logs here, and it looks like Skip Medevac brought her in from out of state.
Yeah, to
Nova,
LSIA, I believe.
Anita, Bobby. Who else? Jess changed her hair for a while, so did Charlotte. I got my hair forcefully done. Daisy.
Second. Are you talking about the Red Gang?
Yep.
Yeah,
Red
she
Hair
is.
Gang? Yeah. Yeah, no, they all had that was a day and a half. Oh my god.
Yeah, you don't have a lot to
Is
go
she
on,
is she
deputy?
conscious, doctor?
I know she's not conscious right now. She's just maintained by life support. Vitals are critically low.
Yeah, her vitals are in a critical state right now. We
Okay.
couldn't continue working on her. I did as much as I could, but she still has some injuries that still need to be treated, along with an open head wound. Well, obviously we have bandaging over it, but it's open so that her brain can swell, and the bleeding can hopefully not cause her brain to swell too much. We have her on some antibiotics already, and then some anti-swelling medications that are going to help to hopefully help her. But yeah, she's in a rough state, and then still in a state of we don't know whether she'll make it at this point.
Okay. Now did someone alert? Does she have like a contact list or?
I mean, if you can identify her fully, then we can start going from there. I mean, as much as we can identify her based off of the leg and all, which is we just need to make sure
My
that we're 100%
surgeries,
sure.
Yeah.
Well, any photographic evidence we have of her.
If we can get a
I mean, DNA or
fingerprint?
fingerprinting is what I'm saying.
Yeah.
Yeah. Okay. Hold on. I gotta make a phone call real quick.
Right.
Yeah, it's really hard. I think they're gonna be able to look at her fingers. Skin's been ripped. Might be very difficult to get an ID. It's a tough job for that deputy.
Then we're gonna have to probably take a little sample DNA. A little blood sample would be good too, or a DNA swab. But all over
Well,
the
that
officer.
I would have you know, that's my specialty.
Her nails.
Oh my god, I didn't notice that. Bandages, they were right there over there. Okay, I'm gonna be very careful with those. Clean these bandages. Hey, Skip, you smell like garlic. Go away. Or stay here, because I got questions.
It's Natasha Russell, state ID 1508. Member of the Chaos Legion.
I'm gonna be fine. I'm gonna get better.
Clean all these. Sure. Think it's infected. We don't want temperature to rise.
We can probably do physical therapy with her, Skip.
Skip, don't be so negative. Can we do miracles here? Sure, everything should be okay.
Yeah. This should be fine though.
All right, so based on what Dr. Skip was telling me about her fingers, I don't think I don't think I'm going to be able to fingerprint her. And she doesn't have, if this is Natasha, she doesn't have any DNA on profile. And I also don't think I have I think it would be a rights violation to take her DNA
That's okay.
anyway. So what I am going to go do is, and also photographic evidence doesn't have any of her tattoos showing. Maybe just like a tiny little bit of one, but that's like far from a positive idea, I think, especially with her hair being different. I'm going to go outside in the hallway and talk to the Chaos Legion people that are out there and see if I can't get any more information.
Yeah.
But otherwise, I think that's just about all I can really do, unless y'all got any more information for me to put in this report here you can think of.
We see. Dr. Skip, you see anything we're missing here?
Okay, that's a given, Skip. Jesus
Skip,
Christ.
come on.
Yeah, well, I mean, Skip's kind of he's got nice hands, but he's kind of a crass fella. If she does end up not making it, I will be able to come in and document her more thoroughly. Like I said, take that kind of DNA, that kind of thing. However, we don't have any DNA on file, so it's kind of. I'm just gonna go see if I can't rummage up some information from her possible friends outside, see what's going on.
Okay. Thank you.
Skip was wondering if there's any way, like if you have any way to ID her. I don't know.
We can probably do a blood test.
Yeah, but
Yeah,
we have to
it's
match
look
it
like
against DNA sample.
yeah, and unfortunately, we don't have any previously on file for Natasha Russell.
You guys don't, but I've done surgeries and stuff on her before, so I might be able
Okay.
to find something.
All right. Well, let me go ahead and airdrop you guys my number, and y'all can give me a call or text if anything else develops.
Okay, we won't take it right now. All right.
Okay. There's my
much.
number. Just airdropped it for you. It'll be Deputy Jonas Slow, 757. All right, thank y'all.
Dave, do you want to go let him out?
Yes.
And make sure to lock the door.
Yeah. Come with me, Deputy Show.
Thank you,
Lock
brother.
the door. Go ahead.
Howdy, y'all.
Yeah, we won't take any blood now, just in case.
Let's keep her.
It does kill her.
In the case of having to.
Okay. This is Blaine Green.
That's stuff to do, and I didn't want to.
It's very dangerous, Doctor Skip. Let me look into that.
Just worry about me in general.
See if there's pressure building up.
Worry about me in general.
mean, Dr. Skip thinks that it might take months for everything to
To recover.
heal up.
It's fine. I had to deal with her like that for a while.
It's not even sure.
I've seen her like this in the past, just as bad.
So you know her?
The first time I met her was in this exact same scenario.
Yeah.
Wait,
4 surgeries
was she?
I had to do.
Who? Who was she? Was she an officer?
She was an officer, Bobby Russell.
I know Bobby.
Mhm.
You know, I've known Bobby for years.
Yep.
Just
It took me a while to recognize her, but I saw the hair, and then I kind of recognized the tattoo, this tattoo here.
you know,
But then I thought about it when Jackie said plate. So then I decided to have a look because I had to remove her left leg. You could probably even see. Let's have a look at her kidneys.
Right.
I had to replace, I think, her right kidney.
right?
It was either her right or left kidney I had to replace.
She.
There might still be some
Rest on
scarring.
my
It's
knee.
from long, long ago. It's from long, long ago.
Okay.
You won't be able to find, like, as in it's from 7 years ago.
Yeah.
But there's so much scarring, I don't even know. Oh
Here,
God.
can't see. When I look up for the report, I can't find.
See?
If you could please skip.
Did Skip say something? I missed it.
He was just covering her up a bit more, that was all.
When I do leave, do I
Yeah.
put, should I, is my arm gonna be okay?
There's
Like,
whip
or should I
marks
just
over
like
her.
secure it in a sling or what?
I should probably stay over here.
So, I'm gonna go put a hazmat. Make sure that I don't bring anything in here. Okay.
No, you should be fine.
Yeah. It's a
You
clean room
haven't
now.
been treating, you haven't treated anyone else,
Trying to
so.
like
Yeah.
But it might be a thing of we might have to do that. Not hazmat, but like just mask up, clean gloves. Just make sure everything is sterile and clean in here for her.
Okay. Well, I'm gonna keep cleaning the body. I don't want anything to ruin.
This is the exact same thing that happened in the past too. Anyone who entered her room had to fully clean down, decontaminate. Had to wear masks around her. Take the stubborn butt to the bloody court case, fully masked up.
Very gentle and remove these bandages and clean underneath. I don't want any germs to fester in there. Very gentle. Skin's so irritated.
It's like a pressure.
Very, very light pressure. For nothing. some bleeding going on right here. I think I'm gonna stop removing more. I think these bandages are actually keeping everything real tight here. Okay, Dr. Skip, I won't.
As long as it's still,
Yeah,
as long as you just clean around the outside, yeah.
Yeah.
Just don't move any of the bandaging for the time being.
Those medications should be kicking in a little bit more. Hopefully they'll help deal with your stress and anxiety a little bit.
You do know I'm still gonna ride my motorbike with my shoulder, right?
You're still gonna do what, huh?
Riding
Don't you
my-
dare, Aaron.
Oh no!
this left leg. I agree with Dr. Skip. This left leg really does not look great.
Yep. It's called a car.
But my motorbike is faster.
I know how you feel about motorcycles. I feel the same way. But it can make it worse.
But
Zoom zoom.
yes.
You have
Well, I
food?
recommend that you don't do it.
My arm around.
Does any of you have food?
Yeah. Yeah, I got you, man. Never mind.
Hey, Dave.
Corolla, how's it going?
You are not Pretty good. How are you?
Good. Be right back.
Sorry, sneeze.
People now. These balls are too
How you
thin.
doing, Travis?
I'm gonna do sign language from now on.
What's funny, Aaron, is I understand sign language too.
But you can't see that through walls.
That's true. I can't.
It's got a flag. Why has this got an engine? It's a turbo. I'm probably gonna head out soon anyway.
So, Dr. Watson, I can't find the report.
No, as I said, it's from 7 years ago. You won't be able to find
Okay.
it.
Understand.
Yeah. That's what I mean. That's the first time I met her was like 7, 8 years ago. Was when I had to do surgery on her because she was tortured by a serial killer.
It's the worst. Okay. Dr. Skip, do you have any suggestions? Any pointers that I should know?
No. Not sure. Texted last night.
There's one more thing. Why we're even searching for them again?
Josh
Because
is
they
not
didn't see
around.
any.
So, Dr. Perry, what do you think be the way
Going
to
wreck my bike.
identify to make sure that this is Tasha Russell?
We have to wait
Okay.
until she's better.
So who's gonna tell the people outside that are waiting for this person. How do we go about it?
I know it is. Deep down in my gut, I know it is. Because there's no reason why a random person would have my name on there
Correct.
and other things. 1 second.
No
Hi,
worries.
Snoopy.
Yeah. Text Seamus see if he's around, but I don't know if he's even around. It's a Sunday, isn't it? So a lot of people don't come around.
So I'm right here.
It's only
Gentle.
lemonless cheese.
The other side.
Oh, hey. We're escaping the ICU.
Less scars. Which it's easier to clean. Here we go. Clean. Oh, I see some bleeding right. With some light pressure. Sure, there's no infection. Then bandage those wounds. Go. Dr. Skip is still bleeding. Stack a second bandage on top of it. Sure it absorbs. I don't want to put too much pressure. I feel it's gonna do too much damage if I do. I think at this point we just make sure that the IV and everything. Noticing that the O2 level is a little bit low right now. Sure, the mask is probably there's no airflow leaving the mask. Now let's take a look at this tube. Sure, it's not folded, locked. Oh, it's okay. With the other vitals. Listening to the heart right now. Very low. Was that Dr. Skip? I didn't get what you were saying. Yeah, I agree with you. Life support's really keeping her all together right now. So, Dr. Skip, do you recommend anything that I should do right now? What I'm hearing, Dr. Skip, is just leave her on the life support in the ICU. And it might take a little bit of time, probably months, until her body sorts it out. Or doesn't. You have like a timeline, Dr. Skip, for like later when she's healed? Because right now I don't think she's strong enough to survive. You think in a day or two? Okay. Yeah, we'll schedule that in. Okay. So at this point, Dr. Skip, I think we're gonna leave this patient to rest, and we're gonna schedule an operating room for 1 or 2 days from now. See if Dr. Leg can help out with it.
I'm really good with Legos if you need help.
No?
Good at putting stuff together. Hello. I also know how to do connects.
Interesting.
Diplos. Hell yeah, it was. No, but you don't understand. I took the bionicles and then I light them on fire. So melt. Mm-hmm. Yep. Yep. In a nutshell.
Hey, Dr. Skip, I'm gonna let Natasha, if that's your name, like to rest and get strong for the operation in 1 or 2 days. We're gonna schedule everything.
Remember Lincoln Logs? Those are great.
Well, we got shots fired.
Yeah, it's outside the hospital. It's over towards like the city hall. So.
Oh, do you have time to talk to me?
I know that it was Australian.
In the middle of a meeting, you're gonna have to give me a second. Apologies.
So, how does it look like, Doc?
Um,
Oh,
It looks to me like there's a president here. You need to shut up.
I have something for you.
I bet.
It's a vegetable. Oh, thank you.
It's the second time I've had to interrupt you on this. Keep in check.
So, I need to talk to Dr. Legs, and then to see what's my options. Because right now I can't talk about anything. So as soon as I talk to Dr. Legs, I can talk to you about anything.
Okay, then we've been waiting enough, I think.
It's a question of confirming identity, basically. That's it's being a struggle.
You really don't want me to pry open those door and go in there anyway, alright? So
I understand, and I don't want that either. And I really like say if it is the person that you think it is, really, she right now that person requires to rest, um, and then there's gonna be medical procedures performed in the coming days. So, but I can't say more on risk, you know, me not being able to do those things in 2 days, and I really want to take part of that. So, yeah, I need to talk to Dr. Legs before I do anything else.
okay, bring him in.
I'm gonna go get him. Where you at? Misha's getting really impatient. She's talking about busting on those doors, getting in.
I'm sorry. Like, until we can identify her as their member, like, there's not much we can do. Like, they have to be patient.
Yeah, Misha's not really patient. Okay.
Harry's coming.
Thank you. Oh, hey.
Hello. How you doing, buddy?
I'm doing good. There's a lot of emotions come back there, so.
Alright.
Oh,
Hey,
wait, you're behind
guys.
me. Oh, you're behind me.
Yeah. Hi.
Hi, let me in.
Yeah.
So I
What's
can
that?
talk to you.
Okay.
Hey.
There's a lot of
Yeah,
they're
'cause
very
they hate
impatient
it.
right now, and they just want
'Cause
to.
they want to see.
Yeah. They want to bust down the
But they'll
door
be-
and come in.
Um,
Cause it's not good for her. Cause we don't want anything. You know, there's.
Chaos Legion in just to view through the window. Would that be okay? We can lock the door down just so
Yeah.
they can just see. You think so? If we lock the
Okay.
door and seal it, it should be good, right?
Okay. Yeah. But I really don't think why are the deputies there? Cause that.
That's because we were talking to them in the meeting and they overheard Jackie say it.
Okay.
So,
Okay. Yeah. I just don't want him to like it.
it's fine.
It's like a light to a match, you know.
I trust them. Okay, just
Okay.
lock this door.
Yep.
Just,
I'm gonna. Yep. Yeah. Yeah.
I'll talk to them about it. Just seal it up. Oh wait, I need to unlock the door. Shit. Fuck. Piss. hand off of me. That's not opening the door.
Oh, sorry.
Have they ever
Okay.
been arrested
Um,
for any felonies, violence?
I'm pretty sure.
Yep, I believe so.
I'll say they're all good to go in.
Oh, we can go
there
in?
you guys go.
Yes.
No,
But
no.
before you go
We're
in,
gonna give you a warning.
yeah, just know that you cannot go in the room, because nobody can bring in any germs that could make it difficult. So the door is locked to her room. Do not go in, please. But you can look at her from outside of the room. Okay?
Okay.
Is that all good?
Okay.
I'll say, Misha, you can be agreements with me because you've seen Natasha a lot as well, so you'll be able to tell if it is her as well, right?
Yeah.
Because I confirmed it is her, but we can't get any bloods of that right now.
Also, she's never been arrested for a violent felony.
Has she never been arrested for a violent felony?
No.
Nope.
What the fuck?
It's mainly
That
because they are
means-
very bad at their job and they didn't catch her for murder.
Ah, okay,
Oh, they're
that
just
makes
very,
more
very
sense.
pleasant
Yeah,
and
okay,
down
yeah,
to
that makes
push,
more
you know.
sense. Yeah.
Yeah.
We love
Come
you,
on in.
Billy Aspen. I love you, Billy Aspen. Okay. Okay.
It's
Just have a
right
look through
here.
the door.
No, don't go in, please.
Yeah, the door's
It's kind of hard to see her face from here, so.
But you can see the tattoos almost, right?
Storm.
How's it going? Missed you so much.
Yeah, I miss you
Haven't
too.
seen you in ages.
I sleep a lot.
Yeah, I know. I can imagine.
Do you have more food? Cause I'm starving.
Yes, I do.
Okay. Hard to explain.
Not the most hygienic thing in the world, but it'll work.
Don't worry about it.
It looked like she'd been tortured.
So there's gonna be a procedure in yeah, I have to schedule it with Dr. Skip in 1 or 2 days where there's gonna be a medical procedures she's gonna be operated on and stabilize everything. But right
Okay.
now she needs rest. No contaminants. Anything that I tried, either cleaning or even changing bandages, just resulted in more bleeding. So at this point, we're just making sure that she's comfortable, she's okay, and she's not conscious. But her vitals are really low, so we don't want to aggravate anything.
Mhm.
Yep. At this point, that's all. That's all I can say. Yep. And I trust Dr. Perry when she says that she knows who this is, but since we can't do any identification because basically there's all her fingers are all the skin is broken, and we can't take any samples because that would be too dangerous right now.
Yeah.
She had a bracelet on that said my name, so
Sorry?
she had a bracelet that said my name. And her left leg was missing. No, yeah, left foot was missing.
She has a metal plate in her head.
The left foot I removed years ago.
Such a nice touch.
She'll pull through. She's too tough to go down like that. She always pulls through.
Yeah, I've known her for years. She'll pull through.
She's too stubborn.
Oh, that's
That's
Damn
100.
sure.
That's 200%.
You know what, Nad?
Hey guys, did you all get the breakdown on everything?
Oh yeah, Jackie did this. Jackie did the little bit of surgery. If you want a little bit more.
You've already made Vicky cry after you once. You don't want your sponsor to cry again, right?
TLDR.
Yeah, does everyone want to hear the breakdown, or so you guys? At least
Doctor, I know you're on duty, but if you want to shut up right now, I'm literally gonna tell somebody here to fucking knock you out. So shut the fuck up. Thank you.
Hey, motherfucker! I'm the one who did the surgery, and I'm literally trying to ask if you want an update on what the
Very
surgery
much
had.
appreciate you, but
Do you want the update or not? That's the only one I'm asking.
oh, okay. Update Ted here, and don't shout.
I got you. Go ahead.
Okay, I mean, come on. All right. She came in with a shit ton of torture wounds, as far as we can tell. She had a bullet in her back that had been left in her and isn't fully infected. We were able to remove the bullet and then close up the wound. Along with, she had a open fracture. Her right leg was broken with the bone sticking out. And we went ahead and broke the leg and then put the fracture back in so that it can heal properly, because obviously you can't just have the bone out of the skin. She had a brain injury where it looked like she got hit with a metal. She got hit with something that caused the metal plate in her head to bend, and we had to remove that metal plate. And her skull fracture was so bad you could already see her brain. Luckily, there's only some small bleed so far, which we were able to stop. The bleeding has stopped on that regard, and then she has a number again of torture wounds, whips. It seems like were possibly used on her. She's got a number of infections right now. The one in her back, obviously from the bullet wound. The leg is infected, not as bad. Luckily, we don't have to remove the leg, but we do have to.
You guys said day or two.
Yeah, so basically, the thing you're missing, Dr. Legs, is Dr. Skip was telling me about. Right now, we can't do anything because anything that we do creates some bleeding, and then
No, I already know. That was the last part of the surgery. Is the reason we had to stop was because we literally she's too unstable at this point, so we need to wait for her to stabilize further before we continue working on her. But we've already removed as much of the infection we could around her bullet wound and her leg, and we have her on antibiotics, broad spectrum, along with having her on anti-inflammatories for her brain injury. We're not able to close her brain injury up because she still has a brain bleed that is not fully stopped. We're going to have to wait before we can do much work on that, though. She's not in a good state, basically. Right now, she is very much still in a very critical state, and there's no guarantee that she's going to come to a stable enough place where we can do another surgery.
When would you have the next update?
I mean, hopefully within 24 hours, but I can't say for sure. I mean, it really just depends on Dr. Skip updating us as we go. We've done as much as we can do right now and not cause her more detriment, basically. Because if we keep going, she's going to end up sick, or she's going to end up dead, unfortunately, right now, if we continue trying to work on her.
Yeah, that's why we're closing, locking the doors, making sure nobody that it's a positive air room, basically. No air can get in.
Yeah.
Everybody needs to be masked up and cleaned up, so that's why we're limiting the amount of people that can visit her at this point. But there's going to be another operation schedule in 24 to 48 hours, and then we'll know after that.
Yes. I gotta go deal with another shit show at this point.
Okay.
Thank you, Doctor. Appreciate the update.
Let me know about that
There's a lot
report.
going on, so apologies about things.
No,
shit tons going on right now.
Quite all right. It's understandable.
What was your name again?
It's Ted.
Oh yeah, I think I met you the other day at Mosley's.
Yeah, Mosley's.
Yeah. Okay. So I'm gonna give you my phone number. It's gonna be in the
On the list.
It's Dave Campbell, Dr. Veggy Dave. It's me.
Yes, man.
I'll keep your number.
Yeah.
Right.
Vicky.
I'll keep you informed if there's anything else. Let's check your text once a day, today. And if there's anything,
Take care of that right now. Let's go find it.
find a way to reach you.
Yeah, appreciate it.
Noise. So at this point, I'm gonna stay here as long as you guys stay here.
Okay.
All right. Appreciate you, Veggie Dave.
Noise. I have to remind everybody of something.
Unfortunately, we can't help. Unless if there is anything.
If there's any more information, I'll let you guys know.
Yeah, Ted, you got the rundown, right?
Yeah, I got the rundown, and he's gonna keep in touch with me via text for any updates.
Yeah, Perry, if anything happens, if the situation deteriorates,
I'll let you
tell
guys
me.
know. Yep. Yeah, she
Okay.
should know that I'll probably bring her back from the dead just to do it myself. Sorry. I kept that bitch alive so many times. But I love her like a sister, so.
I just wanted to say, imagine going to a lighthouse to ask for to bring her back from the only.
Don't you fucking dare, please. No. Please do not.
No.
Okay, Dr. Perry. Careful, you don't.
Oh, fuck it, do it.
Don't strain yourself, please.
All right, guys. Perry, you take care too. All right. Thank you, Dave.
Bye, Misha.
Yeah. You
Bye,
better go to sleep.
Archer.
You all take it easy.
So I'm gonna stay
gonna
here as
put-
long as people want to stay here. But yeah.
Yeah. No, I will head out as well. It's like,
Yeah, just need to.
you're gonna pull through. You got this. We miss you.
She's so strong.
She is.
Do you guys mind if I stay here with Arthur?
You can stay here for a little bit, yeah. But they might need to rest in a bit.
You.
I'm actually thinking
Hmm?
I have something better for Arthur to do.
Sweetie, you wanted to stay here?
It is here.
Yeah.
Yes, it is. But you know, sitting here, you won't help her in any way, shape, or form right now. But I have something for you. A little thing that you can help with that actually can help her get better.
If you dare say lighthouse, I will end you.
No, 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 no.
I lost Maddie. I can't lose her too.
You won't lose her.
You won't
I'm not
lose
gonna
her.
lose her.
I won't
Come on,
allow it.
Arthur. Get out and let's go.
She'd probably be your ass for moping around
You can
anyway.
always come back here, okay? You can always come back.
Ines, I'm gonna tell you in a second, Arthur, for what you will be needed.
Dr. Skip, she okay to stay longer? Okay. Okay, there's gonna be a nurse outside, but I'm gonna go off duty right now. If there's anything, Dr. Skip, reach out to me. Right.
I'll stay here for a little bit with this
Okay.
pain in the butt. You just leave the doors unlocked for me, because
Yeah. Just
not
just make sure
okay.
you clean your hands. You know, it'd be better if you.
That's stupid.
Okay, just checking. You know,
I'm joking.
doing my job here. You know, my boss is gonna yell at me if I don't do my job.
you, boss.
Exactly. You don't want to yell at me. You already yell at me about the door or whatever.
Yeah, because you like walk straight in, you
Yeah.
just didn't lock it, and there was
It's
like a room of people outside.
you know, it's one of those days when like you wake up in a bed of a hospital and every door's fucked up. Anyway, yeah,
Okay,
I
thank
gotta
you for
go.
everything, Dave. Yeah, go take it easy.